Exciting to share this, highlighting advancement when it comes to the medical world. So today we're joined by Dr. Brian Hill, an orthopedic surgeon at Jupiter Medical Center, and one of only 9 physicians nationwide offering, it's called Mako, right?
Mako Robotic Shoulder Replacement.
Mako Robotic Shoulder Replacement. This advanced technology designed to improve precision and consistency during surgery. Doctor, tell me all about this surgery, and you're one of 9 doctors doing this. We're lucky to have it right here in our area.
Yeah, it's awesome, and thank you for having me on.
Of course.
So, what the Mako system allows us to do is really provide a very precise and accurate approach to shoulder replacement surgery. So this all starts out with the patient first gets a CT-based 3D plan of their unique anatomy that really maps out their anatomy. And this is before the operating room. Then in the operating room, the surgical system allows very precise bone preparation and allows us to put the implant exactly where we want it to be. And so our hopes are that with this tailored approach to the personalization, the precise placement, we can get patients back to the activities they love and get them back out doing everything they like quicker, and with the implants lasting longer.
Oh, wow. And so I was also kind of reading up on it. In many cases, yes, you're recovering faster, and even in some cases, it's a less painful recovery.
Yeah, exactly. In my own practice, I've been amazed by the less amount of pain that patients are having afterwards. In fact, we've been doing it without narcotics after surgery, which is something that prior really hadn't done. And patients are even, what's a testament is patients are even coming back sooner to get their other shoulder replaced.
Shoulder done, because a lot of times you get it, the first one done, you're like, oh man, I'm not ready.
Yeah, right.
That's fantastic. And so who would be eligible for this? Is this everybody who walks through your door, or is it kind of a specific kind of replacement?
Yeah, so to really decide who's a good candidate, these are patients with bad arthritis or irreparable rotator cuff tears, tears that you can't repair, sometimes bad proximal humerus fractures or shoulder fractures. And so to evaluate if a patient's a good candidate starts with a comprehensive exam. There's a clinical visit where I get images first, do a detailed exam, and then probably most importantly, talk with the patient about what their activity level is and what their goals are. And so really trying to figure out, okay, what are your exact goals and what do we want to get you back to? And the software allows us to really tailor the needs and get them back to that activity.
And so we're talking specifically here about shoulder surgery. Is this already being done with other joints, with knees and hips and so forth?
Yeah, and so shoulder's actually lagging behind. This has been done for knees for quite a while, and we have good evidence that, that it's helped reduce the variability, be more precise with knee implants, and even hips. And now it's coming to shoulder and spine.
Wow.
And so it's exciting technology to get patients back out doing the stuff they like quicker.
That's fantastic, and it's all happening right here at Jupiter Medical Center. Thank you so much, Doctor. Really appreciate it. If you'd like to learn more about this surgery, we have a link to Jupiter Medical Center's website. It talks all about it there on ours, WPBF.com. You can inquire if perhaps you might be a good candidate for this surgery. Thanks again. We appreciate you. Sandra?
All right. Thanks so much, Aaron. Very cool stuff here. Okay.